Alright, welcome to part 2. In this video we're going to talk about what to expect from your German OB appointments, what you might want to pack in your hospital bag, and everything else leading up to actually giving birth. So I'm going to let Tara talk about what it's like at your very first appointments because I was about 34 weeks pregnant-ish when we arrived. So my appointments looked a little bit different than hers at the beginning.
Every single appointment I had, I don't know if it was the same for you, but always a urine sample, blood sample,
Yep.
And then they would take weight and blood pressure. That was across the board. At that first appointment, they assign you your Mother Pass, which is this little passport book that was actually very handy to have because it has all of your information in it. It's a little archaic at first because we're so used to everything so digitally stateside, and this is a physical, obviously as you can see, sheet of paper with everything that you need. So at every appointment they write your notes in there, all of your test results, everything that you need for your pregnancy is documented in there. So that's something that you should keep with you supposedly at all times while you're pregnant. And that is issued at your first appointment, so it does take a little bit longer to get all of that information compiled into there that first time. And then they do a transabdominal ultrasound at that first appointment. One of the frequently asked questions around base is if they give a gown or not at these. It's kind of a mixed bag. At your regular appointments at RBK, a gown is available because they are so used to seeing so many Americans, they have them there. But I've heard at other appointments, or if you're going in outside your scheduled time, you might just need to drop trow, and that's completely normal here. So,
and you can always ask for one. I definitely had a couple appointments where I was not offered one, and I had to ask if they had a gown available. So
yes, so keep that in mind, your comfort level of those types of things. And then at the end of all of those appointments, our OB would print out all of the information, and then they'd also send that back to TRICARE so that they can do the billing. You'll bring your referral with you to the appointment, especially that very first one, and you'll get 2 referrals, one for the ongoing care, one for the actual hospital stay at the end. So make sure you're bringing the right one when you're setting up your first appointments. And then they handled everything on the back end. We didn't see a bill or anything for those.
Yep. And I just kept a folder that had my Mother Pass and all my referrals and everything that they had printed off for me. I just kept it all in one folder and brought that with me every time.
Yep.
And I did get a couple bills randomly. If you get a bill, you just take it into the TRICARE office and they'll take care of it for you. Yeah, and it's totally okay to bring a toddler with you to those appointments. I brought my son. Usually the appointments aren't too long. If you can schedule them earlier in the day, obviously that's a better option, as you do sometimes spend some time waiting to get in to see the doctor. And then towards the end of your pregnancy, you'll have to go in and get the, what do they call it?
The non-stress test.
Yes. Which those take half an hour to do.
And then your other long appointment will be the glucose test. And another difference between stateside and here was here they just go ahead and do the long test, whereas in the stateside normally we do the short, quick 1 hour test, and then if you don't pass, then you graduate. Whereas here you just go straight into the long test, drinking the fluid and sitting there and getting blood drawn every hour for 2 hours or 3 hours. It was a long appointment. So at RBK, I can't speak to how the other hospital worked, but we got an ultrasound at every single appointment, which was a nice change from being back at home where I got a total of 3 ultrasounds my whole pregnancy. And here it was every single appointment. And the cadence of the appointments was about the same, once every month or 2 months. And then at the end, they started getting a little shorter.
Yeah, and I found it really nice, too. The ultrasounds are just those bedside ultrasounds, so you go right into your appointment, and the doctor's there and the nurse, and they just lay you down and do the ultrasound right there without having to make you go to the ultrasound area of the hospital. It's just a bedside ultrasound, and he does all the measurements and can tell you that everything looks good.
For ongoing care, because TRICARE has rules about it, it has to be done by an OB. But typically here in Germany, they only will see midwives throughout their whole pregnancy, and then midwives are responsible for the birth. but here we'll see an OB throughout our prenatal care, and then the midwives will be the ones helping and assisting with typical delivery or a non-emergent delivery. But so the non-stress test is actually done by the midwives. So you kind of have two different parts of the hospital you have to go to, and that's why those appointments can take longer, because you're coordinating the midwife schedule and the OB schedule to make sure that everything's aligning.
Yeah. A big concern I had when we moved here was like, are the midwives going to speak English? How is the translation going to be in the hospital? And the first day I went, when I had to get my mother pass filled out, the nurse that we worked with had very little English. So there was a lot of Google Translate app and things going on there. And then there's also kilograms and things to consider too. So it took a while to get the mother pass filled out. But for the most part, especially the younger midwives that you work with, usually their English is phenomenal. Dr. Sauer's English is phenomenal. I've heard the same thing about Dr. Grau. So as far as the doctors go and the midwives, it's not a big concern. I think it's mostly just the administrative staff, support staff at the hospital that you might have some translation issues with, but it's nothing that Google Translate can't help you with. And I'm pretty sure that there is a translation assistant available like at all times. Is it through TRICARE or is
it's through TRICARE? And if you get that My Care Overseas app, on that very first homepage, there's a button where you can click and they'll coordinate all of that for you.
Okay, so let's talk hospital bag. The hospital will provide you with food, water, postpartum supplies like mesh underwear and cold packs, a bed with a pillow and blanket, a scratchy towel, clothing for your baby, and diapers and wipes. Things that you're going to want to bring for yourself. Number one, a fan. Definitely if it's summertime. Most of the hospitals don't have air conditioning, so keep that in mind. We had our daughter during the hottest week of the year here in August, and so definitely recommend bringing a fan. Maybe one of those stroller fans or spritzer fans are good too. Number two, clothing for mom. So bring your comfy clothes, your nursing clothes, sweatpants, tanks, PJs, anything that's comfortable for you to wear in the hospital. Number three, shower shoes. Number four, bring your usual toiletries. So if you have, face wash or shampoo and conditioner that you like to use, just bring everything that you would normally bring if you're going on a trip. Number five is postpartum supplies. So this is just if you have preference. Again, the hospital will provide everything that you need, but you just might not be the most comfortable. So
you definitely want to get a Perry bottle. They have a pitcher, which is a communal item in the bathroom versus something that's kind of more personal to you.
Some of the ice packs or adult diapers. I can put some links below in the description. And also bring your new mom kit from Patch.
The Patch Clinic does provide a mom care pack of those things that you're typically used to seeing back in stateside, like Dermablast, the witch hazel wipes. They provide Tylenol, that type of thing that here at the hospital, they don't readily offer that.
Number six, make sure you bring your phone charger and an adapter for your phone charger or one of those charging bricks. So sometimes you might be moving around the hospital. You might not be close to somewhere where you can plug in your phone. So it might be a good idea to just bring a charging brick so that you don't have to worry about plugging in your phone. Number seven, entertainment. So you might want to bring a book or a laptop. I would highly recommend downloading your shows or whatever you're going to be doing on your laptop prior to going in, because the Wi-Fi at Robert Bosch wasn't great. Not sure about the other hospitals, but we had really slow Wi-Fi. Number eight, I would bring your own gown. I'm sure they have some if you ask for them, but I prefer to just bring my own. And the one I got was really great, and I'll put a link for that in the description below. Number nine is baby wipes. If you have a preference to baby wipes, I prefer the ones that are wet already. The ones they provide are a little bit different. They're kind of like dry wipes that you wet down. But I prefer just to bring my own. Number 10 is food or snacks. The hospital does provide meals for you, and lunch is the big meal. And here is a photo of the menu at RBK. They had some really fun things to try. I really liked the pancake soup. They provide you all the water, still water or bubbly that you could want, so don't worry about having to bring your own water. Number 11 is your comfort items. So if you want to bring a pillow or a blanket, or a night light. I know some people bring like a battery operated night light for night feeds. For baby, maybe going home outfit if you have something particularly that you want them to wear, take pictures in. And then again, diapers and wipes if you have a preference. And then lastly, number 12 is your marriage license and birth certificates and passports. I would just bring, if you have, a folder with all your important documents, I would just bring it with you. And we'll cover this more in the next video, but you do need to make sure that you bring both you and your spouse, your birth certificates and your marriage license. And then passports is a good idea too. I'm not sure if we needed those or not, but we just brought everything with us, because they do need those to get the birth certificate for your child. In our next video, we'll talk about all things about giving birth in a German hospital, what to expect, how to get a family room, what shared rooms are like, what the epidural process looks like, midwives versus the OB, and everything postpartum care as well in the hospital. So we're going to talk about all of that in the next video. So stay tuned if that's something that you're interested in learning about.